medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi everyone, this is Mitch Ghen. I'm going to talk today about part one of a 3 or 4 part series on the testosterone primer. I think it's much more extensive, the testosterone issue, than any of us ever thought, but I'm going to try to help you think through it logically. Pretty much all men will eventually have lower than optimal testosterone levels. It's inevitable. But that's important. Why? Because every cell from head to toe has a receptor for testosterone, let alone a receptor for estrogen as well as progesterone as well. So obviously that intercellular communication is involved in healthy testosterone levels, and as it reduces, health may also break off as well. Now, circulating testosterone may exert a direct effect on lots of tissues. That's why it's so important. It will maybe undergo conversion to either estradiol or DHT, dihydrotestosterone, via the 5-alpha reductase pathway. And you should be aware that estradiol, DHT, and the DHT product called 3-alpha androstenediol all have roles in reproductive health, bone health, liver health, kidney health, cardiovascular health, dermatologic health, prostate health, penile health, central nervous system function. You get the message. It's very important for men and women if you just listen to that. Testosterone and DHT also may have likely different roles when they express in the various tissues. So whether it's prostate or the testicles or skin, their roles may vary a little bit, but you're getting the message, I hope, that how important optimal testosterone levels are important. Well, with men, normal T levels and dysfunctional androgen receptors, well, they still can have symptoms and they will not be responsive to your testosterone supplementation. What I'm saying is, you can have perfect testosterone, give them all the testosterone you want, but if their androgen receptors are in danger, then they won't get a good result with it. And you might wonder, well, I brought it up, and the man comes back a month later still complaining. Now, before we get into all the diagnostic considerations and how we should look at this, which we'll do in our next episodes, I want to first dispel a myth that doctors often tell their patients, and that is testosterone replacement can cause coronary artery disease. They also talk about it causing cancer of the prostate as well. There's a problem with that. Just think back to high school. How many of your friends in high school with high testosterone levels when you're 18 to 25 years old ever had prostate cancer? Makes you think, right? Well, there's a reason for that. Now, in a new study, there was no evidence. This was a meta-study that actually showed that the treatments of testosterone replacement caused either short-term or medium-term cardiovascular risk. And this was a meta-analysis. It was published in a good journal, Lancet Healthy Longevity. And Hudson, the researcher, and his colleagues conducted a meta-analysis of 35 different trials. Testosterone versus a placebo. We're talking more than 5,600 participants with an average age of about 65 years. 17 of the studies had 3,400 participants, and they followed them for over 9.5 months, and they had the individual data. They were able to look at this data very quickly. What did they find? Well, the all-cause mortality was actually lower in the testosterone group. Yeah, lower, but it wasn't statistically significant, so we can't go crazy on that one. But when they looked at the problems with coronary vascular disease, it was exactly the same. No difference. If there was heart disease coming or it was there already, the testosterone didn't accelerate it, didn't cause it, didn't change it. So testosterone plays an integral role in men's and women's health. On our next videos that we'll be doing over the next course of time, in the next few weeks, we're going to look at how do you diagnose this properly, how do you interpret what you've seen properly, and what can you do about it from a treatment advantage. For Access Laboratories, I'm Dr. Mitch Ghen, and you can always get more information by going to Mitch Ghen, drmitchghen.com. drmitchghen.com. That's drmitchghen.com. Thanks for watching.